Thank you, Teddy. Good afternoon, everyone, and good afternoon, Minnesota. I'm sorry to say we're starting this out. We had 11 COVID-19 related deaths yesterday, and it brings our total to 50 fatalities. Unfortunately, that's the trajectory that things tend to go on. Again, with the announcement of our stay-at-home executive order extending till May 4th, the purpose of that is to ensure that everyone gets the hospital room they need, gets the fighting chance to make sure that they come through this. So, again, I wanted to stress my thanks to Minnesotans for understanding. Nothing more than any of us would want to do is to get back to normal as soon as possible, but we can't let wishful thinking drive us. We need to be driven by the developments around COVID-19, the things that we're doing that work. We need to be nimble enough to pivot and change when we can, and we need to continue those very basic social distancing, washing the hands, staying obviously away from large gatherings. And I say so knowing that that this is a very important week for billions around the world. The holidays that are usually times of last evening. I know there was a lot of seders done by video conferencing and Zoom, and certainly understand the pain that that's bringing, and around the economy. We understand very clearly. I know you're going to hear from Commissioner Grove a little bit on this, but after we finished yesterday's announcements, I received calls from and texts from employers who had already been contacted by the commissioner and others, starting to figure out what do these protocols look like. So I want to thank you for that. We also noted today that the Department of Revenue under Commissioner Bowerly announced that we are extending the grace period on sales and use tax for those businesses, restaurants, bars, places of amusement. We had already pushed those off. They were coming due on 20 April. They will be pushed off till 20 May. And again, the commissioner will spend some time talking about what we're doing with businesses. We're watching very carefully what's happening in the United States Senate around potential for additional help to businesses and state and local governments. Two other executive orders yesterday, and I think it just bears highlighting a little bit of all of the things that are happening here and all the people who are involved with this. The first one may seem, and again, it's one of those things that maybe people don't spend a lot of time thinking about, but certainly when you need it, it needs to be done. Our septic tank, we issued an executive order for the trucks to make sure that they get out there to do the pumping services to keep things working the way they're supposed to. So it may not be glamorous, but it is absolutely necessary, and a thank you to the folks who are making sure that everything continues to function as it should. And the second one was authorizing the Commissioner of Health to suspend certain requirements that fall under their regulatory authority. Basically what that did was allow for bed moratoriums to making sure we're upping the right numbers for our surge capacity and those freestanding alternate care sites. So that allowed them to make some of these changes as they're working around the clock to make sense. I also spent the morning on different numbers of calls. I spoke pretty extensively to a lot of our tribal leaders and the things that they're doing. They're very dependent on the federal government's responsibilities, treaty responsibilities, but I'm proud to hear them say that they're hearing amongst their counterparts across the nation that Minnesota's state and local governments are stepping up more than almost any place else. So I want to say thank you for that, for showing that true one Minnesota spirit with our 11 sovereign nations. Spoke with the rural electric cooperatives again, noting that many of them have and are making sure that power stays on during this time. Their folks are out there. They're preparing for potential spring tornadoes and rough weather. We got snow coming in today, and they're re-stressing how they're taking care of their members, but that it's hard on them too. So I've spent time there. And then the last group I spoke to some of our folks in transportation, freight train operators and our transit operators. And I just want to give a big thank you to all of them. I spoke extensively with some folks down in Rochester about what it means to be moving patients. They just asked for everyone's cooperation and patience, asked, to make sure we're boarding by those back doors that have now been implemented. Try to wear the face masks as CDC and our own health department are asking people to do when they're outside and in those situations, and to ride transit, when you need to. I know most people are doing that in social distancing, but they stressed it. And brings me to just a final point before I turn it over to Commissioner Malcolm to give some more details on what's happening. MnDOT, our Department of Transportation, is participating in the global Light It Blue campaign. Tonight, the Interstate 35W bridge will be lit up blue in honor of healthcare workers and all other essential workers. Other landmark buildings, both in Minneapolis, across this country, and across the world, really is an opportunity to show that we're in it together. So there's a whole lot of heroes. It's hard to list them all. Tonight will be a moment that will light up the world a little bit to say thank you that's happening. And that's how we're going to get through this again, Minnesota. As I said yesterday, if we hold together here, if we do this and continue this social distancing, if we let our best and brightest minds get us the testing and get us the therapeutics and eventually get us the vaccine, we'll get this thing done. And with that, I'd like to turn it over to Commissioner Malcolm from the Minnesota Department of Health.
Thank you, Governor. Good afternoon. I will just share briefly with you some of the statistical highlights. The global total as of this morning was very near 1.5 million cases and very near 90,000 deaths around the world. In the United States, we are now over 432,000 confirmed cases, over 150,000 in the state of New York, just under 82,000 in the New York City alone. The United States is reporting just under 15,000 deaths, just under 4,600 in New York City alone. In Minnesota, we now have a total of 1,242 laboratory confirmed cases in the state. That's up 88 from yesterday's total. And as I mentioned yesterday, one of the statistics we're keeping an eye on is the so-called case doubling rate, how many days it takes to double the rate of growth, and that has remained stable at about 8 days for the last several days that we see a doubling of cases in Minnesota. That's just a kind of an important sub-indicator that we're watching closely to keep an eye on the rate of growth. And as the governor mentioned, sadly, we had our largest number of deaths related to COVID-19 yesterday, 11 more deaths for a new total of 50 collectively in the state. There were 3 people in their 70s, 4 in their 80s, and 4 in their 90s. So the age distribution of the deaths continues to skew toward the elderly, as we have expected. As of today, there are 145 patients currently in the hospital. That is an increase of 10 yesterday. There were 11 more patients added to medical surgical beds and 1 fewer actually in intensive care. So of that 145 total today, 63 of those are in intensive care. I'd like to spend a minute talking about the importance of getting the statistics right when it comes to counting deaths related to COVID-19. And there's been some, I think, confusion about this and some misinformation about this circulating in social media that I just wanted to address head on today. Last week, on April 2nd, the CDC's National Vital Statistics System published specific guidance on how to report the cause of death on death certificates for cases involving COVID-19. There can be a lot of variation in how cause of death information is recorded, and it's really important that there's as much consistency as we can get on this, because that accuracy helps us to have a better understanding of the real prevalence of this disease, especially at a time when the testing process is still more limited than we would like. As we've talked over and over again, we know that test-confirmed cases are the tip of the iceberg. The latest CDC guidance was a follow-up to earlier similar guidance from CDC that was trying to help standardize the early reporting. Without this standardization, it's likely that the same kind of variation we've seen for years in cause of death statements could lead to some real confusion and records problems when we later go back to try to determine how many people actually died from COVID-19. So there was a reason why CDC wanted to be quite specific about the guidance related to COVID-19. Following that federal guidance, our Health Department Office of Vital Records has been working to ensure that deaths will be counted as confirmed COVID-19 deaths only when the information that a medical certifier provides in a written cause of death statement explicitly mentions COVID-19, not counting other variations like corona infection due to pandemic or non-standard abbreviations like COV. And so who is a medical certifier? That is physicians, advanced practice registered nurses, and physician assistants. So the standard information that is reported then into our vital records office is then sent to the CDC and coded into the global system of standardized records known as ICD-10 coding. There are death records that list the immediate cause of death as COVID-19 because it was confirmed through laboratory testing. When deaths are registered as suspected or probable COVID-19, we don't just leave it at that. The MDH Office of Vital Records staff follows up on these death records. Staff contact the medical certifiers to ask them if testing came back to confirm COVID-19. When it has, the medical certifier updates the cause of death statement that they previously registered or provided. There might be records that stay as suspected or probable if the cause of death statement was written but testing was never ordered or the record doesn't get updated by the healthcare provider. These will be coded with ICD-10 codes that are related to but different from the confirmed COVID-19 deaths and will not be counted as COVID-19. This allows us to have better clarity on the confirmed number of COVID-19 deaths versus deaths that may be but that are remaining in less certain status. It's important to know that all of these processes are similar to those that have been used in other disaster responses over the years, including hurricanes and other outbreaks. Certainly it's the case that there were deaths that happened before testing was available, in which patients died of a cause that had symptoms similar to COVID-19, but an infection was never confirmed, and the person who died may already be buried or cremated, and no further testing is possible. A key point to emphasize here is that the only people who can retroactively change the cause of death statement on filed death records are the medical certifier, the physician, the advanced practice registered nurse, or the physician's assistant who certified the death record, or the medical examiner and coroner who has jurisdiction over the death. MDH Office of Vital Records staff facilitate the correction process, but we do not make changes without that documentation and involvement of the medical certifier. Correcting a record to ensure accuracy is important to us, and it's important for public health and for families, and so that's why we're doing the extra investigations to try to correct the records where that is possible to do. There's absolutely no policy or political motivation to increase the number of deaths that are reported. So we just ask people to try to help us clear up this confusion around the guidance and why it is that we are looking to assure that these death totals are as accurate as they can be. And with that, I will turn it over to Director Kelly.
Thank you, Commissioner, and good afternoon, everyone. Making good use of the extra time we've been given to get ready. Late yesterday, we sent another request to FEMA. I asked them to approve what's known as non-congregate sheltering for this incident, and I know that's kind of a mouthful, but it simply means that we would like to be eligible to get reimbursed for providing people affected by COVID-19 a separate place to live while they go through quarantine or isolation in order to reduce community spread of the virus. In a typical natural disaster, we put together congregate shelters, and to congregate means to collect in a group. And to illustrate what that means for sheltering, let's say the river comes up and we have to evacuate part of town. We set up cots on the high school gym floor, bring in food, water, diapers, and other supplies. People go to the shelter and live in a group setting until the danger passes and they can go home. That type of sheltering is common as well as cheap and easy, and FEMA typically pays for that without pre-approval. Having people exposed to coronavirus live together or be around others who haven't been exposed is a bad idea. That just makes it easier for the virus to spread. If a congregate shelter, a group shelter, is a bad idea, we need to provide non-congregate housing, and we're asking FEMA to commit to pay those costs. So remember, when someone tests positive or has been exposed to COVID-19, they need to go into isolation or quarantine until there isn't a risk of affecting anyone else. The doctor tells you to go home, isolate yourself for a couple of weeks, and call the clinic if your conditions get worse. But what if that's not possible? What if the person is experiencing homelessness? They don't have a home to go to. What if the person can't return to their usual residence because of the risk of exposing other household members to the virus? Think of a couple who share a studio apartment. In these and a lot of other scenarios, we need to provide people a safe place to quarantine so we don't make the problem worse. Our plan is to put affected people up in hotel rooms, dorm rooms, or the like, and provide the support they'll need to complete their isolation period if they can't do it at home. Instead of creating a complicated shelter system, we just want to use the space that's already available, compensate the owner, and get reimbursed by FEMA for the cost. And we think this simple approach will help Minnesota get through this thing by taking care of people and not adding to the risk of community spread. We'll keep you posted when we hear back from FEMA on our request. Thank you, and I'll turn things over to Commissioner Grove. Commissioner.
Thank you, Director Kelly. Good afternoon, everyone. As the governor said a moment ago, we are beginning to plan for what protocols might allow us to get some of the 18% of the non-critical workforce in Minnesota that's currently not working back into the labor market. We're working with our colleagues at the Health Department and Labor and Industry on what that could look like, what kind of social distancing could we do to get there while making sure that we don't lose any ground on the amazing progress people of Minnesota have given us on fighting the virus by staying at home and social distancing. So we're talking to lots of business leaders, labor leaders on this topic, and just getting some great advice and innovative ideas, and we'll continue to do that in the coming days. As I said yesterday, we were the first state in the country to authorize the additional $600 top-off payments from the CARES Act that the federal government approved. We have now cleared more than 236,000 applications that were eligible for those benefits, totaling $141 million, and we're clearing more by the minute. So we'll continue to do that to give Minnesotans the money that they deserve from that federal CARES Act. We saw yesterday 18,762 new unemployment insurance applications. That's down compared to last week at this time when we had 24,504. So again, each day we've seen kind of a decline in the number coming in, still high numbers, but since last Friday, every day has been a week-over-week decline from the past week. And again, we believe this is just because the governor moved very quickly right away to open up those benefits to people affected by COVID-19. So we got kind of a jump start on this, which was, I think, really useful for Minnesotans and for our team to begin to make progress on these important levers to provide for economic security. We encourage people to continue to use UIMN.org. Our call lines are open. The wait times are getting better. We're averaging about an hour. We want to encourage folks to call in the morning. That's just a better time to call. The lines are a little lighter then. And just to try to be patient when you're on hold. If you hang up and start over, of course, you're kind of back to the end of the line. So this is a difficult time, and we know sometimes talking to a person makes a difference. So call in if you'd like. But again, UIMN.org is the best place to get answers and apply directly to our system. Wanted to give a little bit of a deeper dive in unemployment insurance applications. We are at a total now since March 16th of 385,318 new unemployment insurance applications. You saw the federal numbers out today, over 16 million nationally. So this is happening in every state, of course. The top occupational groups that we have seen thus far are as follows: food preparation and serving at 74,574, sales and service at 38,799, healthcare including practitioners and support at 36,668, office administrative support at 28,785, and production at 20,491. So as you can see in those occupations, particularly food prep and healthcare practitioners and support staff match up a lot with positions that are also hiring in other vectors, and we'll get to that next. I want to just highlight that, of course, there are firms that are hiring. The National Labor Exchange, which is how we measure employment here, saw 4,815 new job postings. That's just a sampling of all the postings in the state, but it gives us kind of a good look into who is hiring right now, and it's up 3% from last week. And the top 10 occupations being hired are home health aides, personal care aides, security guards, social and human service assistants, combined food prep and serving workers, registered nurses, customer service representatives, first-line supervisors of food prep, first-line supervisors of office and administrative support, software developers, nursing assistants, and computer system analysts. So there is a lot of hiring happening as well. We encourage everyone in the state to go to careerforcemn.org and find job opportunities there. We are highlighting all of the growing job opportunities in skilled and demand jobs that are in critical sectors. Of course, our Career Force Center is operating primarily by phone and online. There's just a lot of virtual resources there to take advantage of: online workshops, virtual career fairs, et cetera. So take a look at careerforcemn.org and you'll find out more. We're going to continue to ramp up and help those critical sectors get the workers they need at this really critical time. Lastly, we continue to see businesses do amazing things. We have a Edina-based hockey jersey factory called Gemini Athletic Wear that is sewing hospital-grade face masks with CDC-specified fabric. They've cut 15,000 masks with their production lines and have suddenly become a major supplier to the CDI Vascular Care LifeSparks Nurses Group, with 2,000 masks going out to them and many others. So, great Minnesota story of a hockey jersey company turning into a face mask company at a time when the state needs them most. So we're grateful for companies like Gemini Athletic Wear and others that are retooling their work to help our state get through this time. With that, I'll turn it back to the governor.
Well, thank you, commissioners, and again, thank you to everyone on the media for your flexibility yesterday as we kind of did a pool process. I'm really grateful for that. And now I'd like to open it up for questions to everybody.
Operator, we're ready for questions.
As a reminder, to ask a question, you will need to press star, then the number 1 on your telephone. To withdraw your question, please press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Esme Murphy with WCCOTO-TV.
Thank you, Governor, and thank you, Commissioners, for taking this question. Governor, yesterday you said that you believe the peak of this, according to your models, would occur sometime here in Minnesota in July. What I want to ask you is, what does that mean? Does that mean that the peak will mean that the number of cases will continue to go up through July as far as your model is concerned? And if that is the case, doesn't that mean that some of these extraordinary precautions that we've all had to accept, including a stay-at-home order, will just have to be extended as these numbers continue to grow through what you said would be the peak at mid-July?
Yeah, I'll let Commissioner Malcolm go into some of the details. And again, I remind folks that, there's a confidence interval in there that can stretch from May on. One of the things we know is that the social distancing and the amount of discipline we put into that does impact that. And I've said all along that the longer this goes, and we're learning more every day and no one knows for sure, it's impossible to social distance at this level for a longer extended period of time. So we have to, as the process went on, get smarter. And that is part of our strategy of the testing that you're seeing, and it's moving very quickly, and what the state's going to do, and then some of what we learn about this. So, yes, I think it's almost, if when they were telling us originally that we could, be sheltering in place up for 8 months, that's not sustainable. It's not sustainable economically. It's not sustainable for people to be able to do it. So I'd like Jan to explain a little bit about what peak means and what we think we're able to do as far as being smart about how we manage this, start moving folks back into the workforce and start keeping more of a rhythm of social distancing. So, Commissioner Malcolm.
Yeah, thank you, Governor. And it's a great question, and I think the Governor just explained it quite well, that what peak means is the point in time at which the maximum number of people will not only be infected, but will be requiring hospital care and ICU care on any given day. So as we have stressed over and over again, and a difference between our model and some of the other models is we're taking a very long view of the epidemic as a whole. So when we say peak, that doesn't mean everything is over after the peak. It just means that's the critical time at which we're trying to calibrate the number of people needing care, particularly intensive care, and the availability of that care. As the governor just indicated, the value of population-wide social distancing has been, because we fully well appreciate the cost at which that comes. The value of that is to really create the time to allow us to build up the capacity to deal with that peak. But also the truth is, after we begin to, as the governor said, bring workers back into the workforce in ways that still allow us to protect them and to protect vulnerable people from continuing to spread the virus, doing social distancing, continuing to do those good personal practices of keeping 6 feet of distance, being very vigilant about our personal hand hygiene and so forth. All those things that we've talked about are going to stay with us for a long time. And very likely we will be, and we are, working on strategies to, after the population-wide stay-at-home order is lifted, still continuing good social distancing practices, but continuing to suggest a stronger degree of continued social distancing for the most vulnerable populations. I hope that was helpful.
I guess I'd like to ask a follow-up. If the peak is in mid-July, do you see the social distancing and stay-at-home orders continuing through mid-July in order to protect those of us who have not been exposed to the virus?
Yeah, Jen, I'll mention this, and I'll let you do the expertise on this. One of the things, Esme, and I think might be noted on this, of course, all the data points and watching what we're learning in other places. I was speaking or texting with folks that I know in southern China, and they're coming back on their second wave again. And when we looked at ours, we looked at this over the course of a 12 to 18 month, which a lot of the infectious disease folks are telling us there will probably be 3 waves of this that comes. And what we're trying to figure out, what is the most sustainable way without the incredible disruption that is not sustainable on the economy to be able to get as many folks back. So I have to just, in candidness, we're not exactly certain what that looks like. We're going to learn as we're starting to see what Hong Kong, Macau, they're doing in Korea, Japan, what lessons they're learning, and then incorporate those here. So I can't speak out to that, but what I can tell you is that I thought early on, we've got to figure out a way, and I know Mike Osterholm talks a lot about this, and Commissioner Malcolm and I talk about it. We've got to find a place that works long term and is not just shelter in place alone. And that's this whole strategy of getting those that are most vulnerable. I'm seeing now, and this is a really bad idea, people are promoting, well, we should all just get it right now and be over with it. That's a really, really bad idea. But what people are trying to think about is how do you make sure that we're prepared over the course till we get that vaccine? And I don't know exactly what it looks like. I do know that in this model, it's working till this point, and we're trying to figure out how to transition to that bridge. So it's the best I can give you at this time, but with an absolute commitment that as new data and new inputs come in, that we're prepared to change on that.
Thank you, sir.
Your next question comes from the line of Ricardo Lopez.
Hi. Yes, this question is for Commissioner Malcolm and maybe Governor Walz if he's wanting to weigh in. But I just wanted to go back to what Commissioner Malcolm was speaking about earlier, the disinformation and confusion that she referred to in regards to COVID-19 death count reporting. I think those comments, I had a story up today and wanted to get your thoughts on the comments that are being circulated by 2 state senators here in Minnesota, Scott Jensen and Jim Abler, who are pushing back on the CDC-issued guidance. I don't know if you saw that Senator Jensen was on Fox News last night expounding on this, and so just wanted to, get your thoughts on the record about, this information coming from 2 state elected officials here in the state.
Well, Commissioner Malcolm, I'll let you speak. Yeah, please go, Jan.
Thanks, Governor. I have not spoken to either of the senators personally about this yet. I certainly hope to and would like to. My assumption has been that there was just confusion about what was the CDC's protocol and why. It's detailed. It is attempting to correct records that were unclear for very good reasons, I think, to get the most accurate count we can, but not in any way seeking to inflate the numbers. Again, this only can be done with the involvement of the certifier, and we're looking for cases that were able to be test confirmed. So again, I have not spoken to them directly. I'm hopeful that just trying to clarify what the guidance says and what the intent was would be helpful to kind of correcting to some of that confusion and misinformation.
Ricardo, I've not tracked this. I've not tracked this one at all, so I leave that to Commissioner Malcolm.
Yeah, I mean, I was just going to follow up because these now have appeared on Fox News during their primetime show, The Ingram Angle, as well as making it on InfoWars, which is owned by Alex Jones, the known conspiracy theorist. So these types of views are circulating there. And I think the motivation that's been attributed to it by Senator Jensen is financial. So, I mean, what do you say to people who think that that's why health officials are giving this type of guidance?
Well, I'm sorry, I haven't seen that comment. I can't understand what he might mean by that, a financial motivation. So I'd really like to talk to the senators directly just to make sure we're doing what we can do to clear up any confusion. But I think it's, my hope in speaking to it today was just to explain the process and the legitimacy of getting the information right, and really to ask that people not attribute negative motives to the CDC or to our health department staff who are seeking to implement that guidance.
All right, thank you.
Your next question comes from Tim Nelson with Minnesota Public RAD.
Hi, thanks for taking my question. Governor, I don't know if you're watching the Senate Majority Leader's comments here, but just before the call started here, he came up on Twitter and said he does not approve of your decision to continue the order to shelter at home at May 4th until May 4th. I realize it's not a shelter at home technically, but he says we have to get on with our lives. And then followed it up while we're on the phone here and said, he says, you're expecting up to 5,000 people in ICU this June. New York State has less than 5,000 people in ICU today. Says, we're ready for the surge now. Why are you shutting down Minnesota businesses for a New York-sized surge? What's your response to that?
Well, first of all, we have a confidence interval, anywhere from 3,000 to 5,000, which is more conservative. I'm listening to the healthcare executives, the healthcare experts. I'm listening to Mayo Clinic. I'm using numerous data points from outbreaks elsewhere and looking as this evolves. It has been 13 days since we issued the initial stay-at-home order, and I've made clear that we are continuing to use the newest data and chart a course that allows us to vastly increase our testing and get folks back in. And as I've said all along, I want people back to work as badly as anyone does. This is not a false dichotomy. I don't know if they are somehow ceding that my job is to protect the health of people and their job is to help the economy. It doesn't work that way. It's to do both with the priority of keeping Minnesotans safe, but figuring out ways we can do that together. So I've simply asked time and again, if there are other sources of information that are validated, if they believe the Mayo Clinic's wrong, if they believe all 9 of the healthcare associations are wrong, if they believe that the CDC is wrong, if they believe that the president's guidance from the administration is wrong, and if they believe 42 other states are wrong, then I value their opinion to say so, but we can't go on a hunch. And I hope that I am as wrong as can be about the needs on those beds, but all of the data shows me that I cannot risk that at this time, but I'm trying to find that line with Minnesotans' cooperation, that we can restart the economy in a smart way. I don't know if that means I was supposed to stop it and everybody was going back to work, and that's all I can really comment on it. I'm just being driven. We'll continue to try and make the case. I would hope that just because they don't support it, that they honor the desire. They do not put themselves or others at risk against what we know, and that we continue to work together. And as new information comes out, my pledge to Minnesotans, to legislators is, I will, as I've said, I will certainly change course of action based on the facts, but the facts don't support taking this off right now. No one else is doing that, and no one else is suggesting we do that. And until I see from a wide variety of sources, we think this is the most prudent course forward.
A quick follow-up here. Are you worried that these restrictions are so onerous that they're going to start defiance, that they wind up being counterproductive, and issues like this come up, and now you've got a dissent growing in the state, and the restrictions start to fall apart?
Well, I would say one tweet does not equal dissent. I would say Minnesotans are listening. Yes, always. This is a part of social cooperation. Again, you may be fine and you may have your free will, and you going out may kill someone else's family. This is what we know about this disease. We don't know enough to know about asymptomatic transmission. We're starting to see numbers basing it on one fact in time alone, that there are numerous factors that led the globe, 170 countries to take these things. And now, because, yes, I'm tired of this. I'm frustrated by this. My heart breaks for the people who are worried about their economic well-being. But you can't get frustrated, go on a hunch, and throw caution to the wind and pretend like our neighbors' lives are somehow disposable, because the health experts are telling me this. This is what these nonpartisan experts are gathered around. And yes, there's dissenting opinions on how we go about things. There was dissenting opinions amongst that I was too lax in allowing some of these places to come back open. I remind people that 80% of folks are still working. Now, that is small consolation to the folks who are not, but it is because of the science that we see. So, no, I think Minnesotans understand. I think they're reading. I think it's, again, to think somehow that there would be any pleasure in doing this, or that we would do this if it wasn't the right thing to do, is simply wrong. So I don't worry about Minnesotans. I think Minnesotans are informed. I think they care about their neighbors. I think they're following the data. But I certainly would not dismiss when I see elected leaders who have positions of authority, if they are quoting information that cannot be validated, that cannot be backed up. And again, if they want to say this, they're going to have to say and go against the advice of every single health expert in the state. And I'm going to listen to the health experts.
Our next question comes from Ms. Dana Ferguson with Forum News Service.
Hi, Governor. North Dakota officials have said that residents who own cabins in Minnesota can still visit if they practice social distancing here. Should they come, or should other visitors come into Minnesota at this point?
Well, I don't think travel in general is wise right now. I'm going to be talking to Governor Burgum this afternoon, and we have a good relationship. We're certainly friends, and we've shared data going on to this. So that's one of the things that I'm certainly not encouraging people to go to North Dakota or elsewhere. My folks up north in Minnesota are concerned about people moving. We think it's best to be sheltered close to home. We said you can go outside, but not to not to travel somewhere and get others involved with this. So I'll talk to Governor Burgum this afternoon, and I just want to be clear. One of my frustrations, and again, there'll be plenty of time to understand why, when we didn't get a real coherent national policy and the states had to kind of come up with their own, it created this sense of pitting one against another, and that is not the way it is. Our neighbors in North Dakota are our family and friends and fellow Americans, and that border that's there is a political border, and we do things a little different, and our beautiful democracy and federalism allows the states to do some of those things, but I am not about to try and get into battles with governors who are doing the very best they can. So on this one, I would not encourage people to do that. I'll talk to Governor Burgum about it this afternoon, but it just would be helpful, and it's kind of like these stay-at-home orders. Let's be very clear. Dr. Fauci has been clear about the stay-at-home orders. There has not been a national one issued for whatever reason, and that causes some of this distancing, and on the previous question you heard, creates some of that. If the CDC is issuing it, we're following it. CDC guidance is calling for this social distancing, no travel. So I just want to be clear. Our friends in North Dakota are not the problem with this, but we all do need to kind of get on the same page.
Your next question comes from the line of Bill Werner with Minnesota News Network.
Yeah, good afternoon, Governor. Thank you for taking the question. I'm sure you're aware of the Smithfields Foods meatpacking plant in Sioux Falls shutting down temporarily. My question is not only how is this and perhaps other closures, how are they going to affect Minnesota producers, not only pork producers, but more broadly than that? And also, are you getting any indication at all of a potential impairment of food supplies as a result of this, of people in processing facilities becoming ill with COVID-19?
Yeah, Bill, thank you. It's a great question. In fact, I did just, again, thank you to everybody who's reporting in real time. I just read the stories this morning on Smithfield. Yes, this is a concern. I think they had dozens of cases, and they are shut down because of what can happen if you don't get the social distancing and you don't get things right. You had a major manufacturing plant, in this case pork producing, but food producing, is shut down because of this. So at this point in time, we're not hearing of any disruption to that supply chain, but I think you've hit right on it. That is our deep concern, and especially being home to so many of those. We are constantly talking to the major food manufacturers from General Mills, Cargill, and Land O'Lakes and everyone else about trying to figure this out. And that's one of the pieces we've got to figure out, and lessons that we've learned to get all industries, the essentials like food producing, back in a sustainable way. And that's why I have to tell you, my vision is that at each of these food producing plants, we would test every single person to see who's already had it. We would test every single person if we thought there was a case to get immediate isolation. We would have infrared thermometers or walkthroughs at every door to these places. And that's the way we could ensure that we could get back to work, because we can't just, risk this. If we send, again, this goes back to that question. If we send everybody back without doing this, and we shut down Hormel or we shut down General Mills, that becomes a national problem, not just a Minnesota problem. So in answer to your question, yes, I am deeply concerned about this. Yes, we're tracking the Smithfield situation and hope to have lessons learned, and our team will be following up with our food producers to make sure we don't do that. But at this point in time, I think it's an area to keep a close eye on.
Governor, if I may just do one quick follow-up. I know you can't affect things directly in South Dakota or wherever, but in Minnesota, are you thinking about actually doing this kind of testing or implementing this kind of testing with Minnesota's food processing facilities?
Absolutely. And if I have my way, and again, I don't get out over my skis all that often, but I'm doing it a little bit here. I think, again, what I'm hearing from the federal government, I will mention that our Abbott Labs rapid tests came, as the other governors said, theirs had been coming. Ours came yesterday, and they came with enough chemicals to do 120 tests. Those kits placed at these major facilities would be brilliant. And I just now we're doing our Minnesota moonshot, I think, on this testing, and I'm trying to figure out how to do that. Whether it's possible or not, we'll see. But I just think the Minnesota ingenuity, and with Mayo leading the plasma serology type work, that yes, that's exactly, Bill, what I envision that it should be done. And I just think the situation in South Dakota, and with that concentration around that, is just a huge problem.
Thank you, Governor.
Your next question comes from the line of Matt Sepik with Minnesota Public Radio News.
Hi there. This is for Governor Walz and Commissioner Malcolm. I know you talked yesterday about serology and antibody testing, and you seem to indicate that a national supply might not be sufficient for what states need. And this is in reference to the test that Mayo is working on. Can Minnesota develop and produce its own test, and do you have a plan to use that widely to help get people back to work?
Yes, and thank you. That's a segue from how I just ended a little bit with Bill. Yes, I think that's correct about nationally. And again, I always want to be clear to all the listeners and to the media that I am not interested and I do not have the energy to spend on why we weren't ready on the testing. That's just the reality we live in now. But trying to figure out in the federal government, trying to ramp things up, it is still not sufficient numbers, we think, to get the public back working and move towards normalcy. So I'm trying to figure out if it's possible with some state investments partnering with our labs or the university, could we do that? I mean, I envisioning us being able to test tens of thousands on the spot daily going forward. And Jan may speak to this. One of the problems is everything in today's world is pretty much a global supply chain, and the reagents and some of the supplies with these tests have been in short supply. But in answer to your question is yes, I think the state needs to take this on, and I think it's a good investment for second and third wave of this and lessons learned from this one. So Jan, if you had anything to add to that.
No, I think, Governor, you covered it really well. And I think the realism of just the ambition and the vision of trying to do something unique and to trying to kind of take control of our own destiny, as the governor has said, it's a wonderful goal. It's an inspirational goal that's getting a lot of effort focused in exactly the right ways. And we are fully aware that the global supply chain is so connected that sometimes we find a new shortage that we didn't see coming. You know, whether it was on the swabs, for example, for collecting the diagnostic tests that we've been so focused on up to this point. And again, part of the reason why the governor is wanting to broaden out the types of testing that are done for different purposes. So I really just repeating, I think, what the governor said, but part of the realism that you will also hear from us, I think, is being really honest with Minnesotans about where the risks are, which is very much around supply chain challenges, whether that's on personal protective equipment or testing and the like.
And a quick follow-up, if I may, what's the status of that test now and how things are progressing at Mayo with getting it developed and getting it scaled up and online?
Well, I believe that
Jan, go ahead, Jan.
Go ahead. No, I was just going to say I believe they just came online this week with their FDA approval to stand up this study, and they are leading. There are additional medical centers and universities working with them around the nation, but Mayo's in the lead on it. So, Governor, you want to say more? Yeah, no, that's correct. And I just watched the lead researcher from Mayo was on this morning on one of the cable news networks, and we said exactly what Jan said. They're trying to up it again. The administration is telling governors that they'll be up to 1 million by 1st of May, and then they'll double every several weeks. Again, sounds like a lot. It's not enough, but I just think, and I want to be clear to Minnesotans who are listening, this is not a magic fix that's here today. It's very, very promising. I think it's worth taking a move towards because I think it puts Minnesota in a position, as Commissioner Malcolm used, to control our own destiny. I don't think complaining about we don't have national help at this point in time is counterproductive. And so I do think there's potential. It is approved. We should be able to get some capacity online. I would like to think, but again, staying realistic here. There are still hurdles for us to overcome, but I do believe it's a path forward.
All right, thanks.
Up next is Greta Call with Minnesota Post.
Hi, this is a question for Governor Walz. We're wondering what specifically, when the legislature goes back into session on Tuesday, would you like to get from the legislature in terms of spending stuff, but also in terms of authority to do what you feel you need to do?
Yeah, we put a package together, and again, we're partners with the legislature. And I can't say enough, and I I know sometimes it's tempting to highlight where there's differences. I would have to highlight that it's been absolutely amazing, and there are philosophical differences that are legitimate, and that there needs to be someone questioning every single one of these moves that I'm making, and I applaud that, and I don't dismiss it. But I think the things we're putting together, we think there's more help in there for small businesses. We've got a package of things that helps tweak some of the things we've already done, making sure that we're paying for them correctly. I think we've looked at some changes dealing with corrections. I've said it several times on these calls. I'm really, really worried about some of our facilities, but again, I might use that as a highlight. We've been talking to some of the world's best folks, United States Army folks who are out on Guam working on this, and some MIT researchers who have some modeling around how do you contain an infectious disease in a prison setting, that we're going to maybe make one of our facilities kind of the highlight or the first test run on how to do this right. So there'll be a package of those things in there, some of the funding, and then try and codify some of the executive orders. These legislators are doing a nice job of making sure that they're asking and we're talking to them and put those in. But we'll make sure we get that out. You'll see the thing I would say is, I don't want to get too far out ahead here, is that we are kind of doing that in concert with the minority and the majority in the House and in the Senate. And we're putting over things we'd like to see. They're putting things in there, and we're kind of negotiating what would be a nice package that we can all agree on. And you should see that, I would assume, as they get ready to kick off on Tuesday.
Next is Brian Bast, Minnesota Public Radio.
Hey, Governor, I also have a question about legislative items, but getting back to Bill Werner's question, he was talking about the food production plant in South Dakota. Are you worried about any spillover of cases in southwest Minnesota? Are you seeing any of that, given the proximity? And then I can just get to the quick question on legislative.
Yeah, no, Brian, we haven't seen it yet, but in answer to your question, I'm very worried. There's a lot of, obviously, and this is healthy, and I want to say it again, like I said with our North Dakota, these are our South Dakota relatives and friends, and we're super happy when we have a lot of cross-border interaction, especially around our food production. There is a lot of that. So I do worry. It appears like this thing, and I just read the preliminary stories. It burned pretty hot and shut down a major production facility. And of course, our facilities in Worthington have a lot of people that go back and forth because, this is where a lot of issues that we have kind of intersect. We have a housing shortage in many places, like in Worthington, and a lot of folks drive over from South Dakota, from Sioux Falls, in some of these areas. So yes, I do worry about that. We haven't seen it yet, but we're starting to adjust accordingly. And as I said, I work with these large trade groups and the folks who are engaged. So I'll need us to get back on the phones with our food producers. I'm sure they're rethinking after seeing what happened over there.
And on the legislative front, you announced today this grace period for businesses that would have trouble paying their sales tax payments for March and April. A lot of people and businesses are also getting nervous about the May 15th property tax deadline coming up for first half payments. Are you open to relaxing that at all, including this proposal from Senator Gazelka that the state waive or delay the state's share of the collection for commercial property taxes?
Yeah, I think we need to certainly take a look at it, and I'm certainly open as they bring these up. I just remind people, and I know that this is a very big philosophical split, but taxes are the price we pay in a society to get some of these things done that we do together, whether it's building roads, educating our children, or in this case, fighting coronavirus. But there's a reality of this is it's collecting from people who don't have it doesn't make any sense, and creating loan programs and other things at the same time we're taking from that. This is where I hope, and it's one of the things I would say is why I'm watching the Senate very closely right now and what's happening. This is why the federal government, this is why it's so critical that they are able to backfill us and help states. This is what the number one thing that you hear from governors, the 50 of us on the phone, Democrat and Republican, is the federal government's ability to use stimulus to help states for us to do exactly that. So the answer to that is yes, I am very open to that. I just think we need to, and we'll get a good, sobering look, which we knew was coming, at our state finances, but states are bound by the inability to deficit spend, which makes us good managers and it puts us in good positions like we are. But it also, the federal government and the Fed is the only place that can allow us to get some help. So they'll have to work hand in hand. And I'm feeling more confident about the federal government's help and some of the interpretations around the CARES Act. But as I said yesterday, I'm a little nervous how that thing was constructed because it actually penalizes states like Minnesota who insured more of our people and did a better job. So in answer to your question, yes, I'm open to it. We'll need to hear it. I hear businesses loud and clear on this, and we need to make sure we're helping them.
Great. Thank you.
Your next question is from Tom Hauser with KSTP TV.
Good afternoon, Governor. I want to get back to Senator Gazelka's tweets that he sent out this afternoon. He focuses in on the word unilateral decision. Have you consulted with legislative leaders, both Republicans and Democrats, before extending the stay-at-home? I know especially the Republicans seriously question the numbers coming out of the U of M and the health department model and are concerned about the lack of transparency. Why are the numbers not made publicly available on a daily basis as they're updated like the University of Washington does?
Because that model doesn't run that way. And I want to be clear. Yes, I walked them through all of this. And I think we said yesterday, there are many, many data points that we're using, that we created an early model to help us understand around epidemiological data. We're glad to put that out there, but any of you, the folks who work on this, and when I was working on my doctorate and going through the statistics, you can look at this. This thing is complex. We ran it 1,000 times. It's not like a calculator and you're punching in numbers. I do have to tell you, I am somewhat disappointed that there would be an idea that we wouldn't try and get an accurate count out of what was being put out by the professionals, some of the best in the country, to be able to do that. So we're certainly glad. Yes, we're consulting with them. And yes, Emergency Peacetime Authority, which is granted through a democratically elected system, and all the powers that were granted to the governor came through the legislature. I, again, would be more inclined if I would have ever heard a single word about federal executive overstep or federal executive numbers. The University of Washington is one model. We're using numerous ones from King's College and others to look at this. So I guess if you disagree with the decisions we're making, I am somewhat encouraged that it appears like folks who have dismissed numbers around climate change and things like that are now deeply concerned about how we do science. I will be glad to give them whatever they need, but I would say, and this is just for me, I don't think deliberating in a crisis by tweet is the way to go. So yes, I have been consulting. Yes, before I did the executive order, I walked them through the entire slides for over an hour and a half with all of us on together. So I'll continue to work. I think I get it, and I will re-stress. Every single one of these decisions needs to be questioned. Every single one needs to be put out there, but they need to be questioned on the merit, and they need to be questioned not with you're not getting things or whatever. I would question the folks if they want to look what these epidemiological and epi data that they've run, if seeing what's being inputted and how we're coming up with that, we're more than happy that information's out there. What it will help them do, though, is it's still going to come to the conclusion, if you disagree with the decisions that we're making, that's just one point in time. We're looking at situations as they develop. We're certainly looking at New York's experience, and I'm talking to Governor Cuomo about what they're losing and what they're gaining from this. So I would just ask that we continue to try and find ways together. We certainly are consulting. I disagree that they're unilateral, but I guess that's my opinion then too. If we're getting into that, but I can tell you that I'm sharing as much as I can is real time. We put up the data for all Minnesotans. I'm using that on PPE. I'm listening to the hospitals. If the hospital association told me today, Governor, we got it, send everybody back to work. We got plenty of PPE. We got plenty of doctors. We got plenty of beds. We got plenty of ventilators. We would do it now. But not a single one of them is saying that. So I keep asking them, where is your information coming from? And not just questioning mine, why do you think it's different? Because it's not my data. It's data by the healthcare. And just to be clear, the data in the hospitals themselves and places like Mayo Clinic are more pessimistic than what I have. Now, whether we're both wrong, we certainly hope so. I hope we don't need a single ventilator. But I can't just hope. I have to plan.
Governor Walz, a real quick follow-up. The disconnect is Dr. Fauci is saying now maybe we're going to have 60,000 deaths. He's relying on the Washington model, it appears. And we were told yesterday there could be up to 20,000 in Minnesota alone. And people just have a hard time reconciling that difference.
Yeah. And Tom, in all fairness, you were not told that. And we keep, what I'd like to do is...
Well, we have it on audio. That's exactly what was said.
No. Tom, I'm not going to argue. What I'd like to do is sit down for all of us to understand. And Jan, maybe you can weigh in on this. These models are not meant to predict deaths. They're meant to predict the trends and the differences that they go. And picking out a single point in time is not what the model was intended to do. And as I've said time and time again, when I looked at this, I felt a responsibility to give the number that was shown to me. So if the idea here is that we're super overly pessimistic, every single state is planning the same way, 42 of them on this. And that one data point that's in there and the models that we're using is only one of the things that we're coming up with. We're coming up with where the PPE is at, what the hospital associates are saying, the sentinel testing that we're putting in because we have the lack of actual testing. So our range actually said it could range from anywhere from 6,000 to 36,000. And I do think it needs to be reported that the University of Washington model only projects through August. Ours was projected through the length of this, basically the 12 to 16 months is when they did it. So there's different ways to approach this, but I think focusing solely on that or somehow that it doesn't align up is simply not understanding what that data does. And yes, I think it's complex. I've spent a ton of time on this too and trying to explain to people what this modeling does, what the inputs were, and how they ran it. So I'm encouraging them, and I think tomorrow have the experts who did it spend some time with everybody, spend some time putting this up. But I would just tell people, whether I were using the University of Washington model, King's College, stuff coming out of Harvard and MIT, or the model we're using, the decisions would be very, very similar because of what the hospital associations, because of our PPE and the burn rate, and because of what we're learning about things like the R0 and the transmittability versus the amount of time they're in the hospital. And again, we've been at this basically for 4 weeks, and we have learned immense amounts of things, but with more to come. So I'll keep working it. I'll keep trying to do a better job of articulating exactly what is driving our decisions. I will continue to try and update that model of putting all the information up online, our portal, and continue to try and have them refine as they move to version 3, version 4.
Thank you, Governor.
Operator, we have time for just one more question today.
Okay, and your last question will come from Darren Simpson from KTO Radio.
Governor, this will come off as an either-or type question, and I really don't mean to frame it that way, and it's a poor way to frame it, admittingly. Governor or Commissioner Grove said 385,000 Minnesotans are out of work right now, and every Thursday we're getting a new shock to the system nationally with 16.6 million Americans out of work. Are we getting, with numbers like that, are we getting to the point that some could come to the conclusion that the cure is worse than the virus? Is that a reasonable conclusion to come to, or do we need more information before making that determination?
Well, I would say we certainly need more information. I mean, we're learning the best we can. We're watching the way folks have approached this around the world with the best minds and the best guidance. Many people are unfamiliar with what a pandemic looks like. A lot of folks said it was the flu. I simply think that, again, at this point in time, the 50 lives we've lost wasn't because of what we did. It was because of this is just what it took. The virus took them, but we had the capacity to care the best we could. But again, I think as this evolves, we've done this before too. I have spent and been activated and filled sandbags for weeks that never, ever got wet. They never got wet. We wasted a ton of time, a ton of money, but all of the modeling on the flooding showed us that it was going to happen, and it made sense to do it. So I do think that there's, and I share this deep concern. It's one of the reasons why I'm doing and issued the order yesterday to try and move safely as many people back into the workforce as possible without jeopardizing this. Again, if we had a collapse and it burns through the Mayo Clinic or burns through the university hospital or the food producers, now we have really exacerbated the problem. So I think, there'll be a time where history will write this. I fully expect if I knew someone couldn't swim and I kept them from jumping in the water, you're probably not going to be said you saved them from drowning, but it sure makes sense rather than have them jump in and almost drown. And I think using the best data, using our best judgment, using what people put out there, we're trying to figure that out, but the either or of protecting the economy and protecting people, we're trying to figure out so that it's not that choice.
One quick follow-up. Based on your data analysis, based on the information that you've had, based on the information you get from the ground itself here in Minnesota, how much better are you and the commissioners at planning for what potentially may come now than you were 4 weeks ago?
Well, I think we've all learned. I will speak for the team that's around me. These people continue to do things that simply amaze me. I don't know when any of them are sleeping. Our communication and to be able to manage complex movements. Yesterday I mentioned being in that room was the first time I was with Joe Kelly or Jan Malcolm or Steve Grove or Chris Ayersman and all of these people who are doing massive things, and we've not been in the same room. So I think we've gotten so much better. We're delivering millions of meals to kids and delivering long-distance learning. I think there are positives. I keep telling Minnesotans we're going to be smarter when we come out of this. I think all of us have learned. There were a lot of meetings in our life that could have been emails or conference calls, and I think that's a lesson both for government and outside government that there's going to be some changes to our world that are going to be positive. And I would say inside government, we are becoming more nimble. We are becoming a little less risk adverse in trying to nimble and say, you know what, they're right on this. Let's change. And so I can assure Minnesotans we'll continue to learn. So thank you all for the calls. I usually end, and I think it's appropriate this week of being Holy Week for so many of us, just the goodness and around the children. I thank you to all of the people who are sending me cards and notes, especially those children who are handwriting notes. It brings me great joy. And I saw Catherine Rickert at NPR had a story about Rochester, and when people are out social distancing and walking all around town, children are putting their favorite stuffed animals in the windows, and people are putting them up to surprise people. So you can see giraffes and unicorns and bears and leopards and puppies and kittens in the windows, bringing joy to kids as they walk around. So thank you, Rochester, as always. And to each of you out there, as I said, I know we had a very distant Passover Seder last night for a lot of folks, and I just want to wish folks, my congregation at Pilgrim Lutheran has been doing some wonder devotions online, including some beautiful music for us during Holy Week. And I just want to wish everyone a blessed Easter and take some time with family. And I certainly count my blessings for the decency of the people of Minnesota. So we will talk again soon. Thank you.
Find more local news stories at ccxmedia.org and follow us on social media.